So one question I think that many of us have is how do we still talk to the people that still don't get it, right? There's many of us like you and I who from the beginning of COVID were like, what the hell is going on here? Like, why is everybody gone crazy?
Yeah.
Why are they doing all of these nonsensical things? Like we might have always been on that. And then there was a lot of people who through time woke up, opened their eyes and said, okay, yeah, I give up now. 2 weeks to stop the spread. I was on board with that. I was on board with, a couple of these measures, but now this is going overboard. So there were people that had tolerated kind of those initial, but then they kind of woke up. But it's still, I think the percentage of people who in the end kind of hit that point, I still don't even think it's half of society. I
Yeah.
think that the majority of people still believe that, well, this is, I, in fact, a lot of people think that, well, the reason it didn't work was because of people like you, Kim and Tom. You
Right.
know,
Yeah.
you're the reason why we couldn't actually get any success. How do you propose, you've done a lot of data, you've researched this, you've written an
Yeah.
entire book about it. How do we talk to people and convince them? These are the emotional ones, right? They're not, I mean, we could show data. I think some data for sure maybe would help, but I just feel at a loss with
No,
these
I do
large
too.
groups. Do you know what I
Yeah.
mean?
I do too. I wonder who am I sharing a country with at this point?
Right. Oh
It's
boy, well that was like a big thing at the beginning of COVID when everybody I thought for sure I had viewers of my show writing me emails saying, Kim, lockdowns are coming. And I thought, there's no way. This is
yeah,
America. Americans
right.
will not go for that. And wow, Americans did.
And I was saying, well, by the summer, people will be screaming for these restrictions to be lifted.
Right.
And we can speculate about the psychology behind why somebody would actually almost rejoice in the restrictions. But in terms of your question, I mean, as you say, data can go only so far. But I would say one of the things that was said was that, well, maybe the problem was we had the restrictions, but people didn't comply, as you
Yeah.
said.
Right.
But we have numbers on compliance with, let's say, restaurant people going to restaurants in California and Florida. It's a huge disparity. People did comply. That's how we can tell. We can tell people complied because we can just observe their activity.
Yeah.
And we can see how devastated the hospitality industry was in all these places, precisely because people were complying. And then also, like, there would be little stories, like in California, October, November 2020, there was a spike and in LA, and they blamed that on Lakers and Dodgers fans. Or it might have been 2021. I don't remember. I don't know your California sports well enough. But the point is, that same spike occurred simultaneously in San Diego, and I promise you, in San Diego, they were not cheering for the Dodgers. Okay?
Right.
So they'll just say these things. So what I did was, for those people who can be moved by data, now for those who can't, people have been doing some good documentaries about the real life stories of people who suffered under the restrictions.
Yeah.
But for people who do care about data, I actually made a website partway through all this called covidchartsquiz.com. And it was a quiz where you would be shown charts of two different places, but you wouldn't be told which was which. You'd just be told, now the red line, it represents a state that did blah, 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 and the blue line is a state that didn't. So which do you think is which? And you're always wrong because it's always random. Or
Right.
here are 5 European countries. Here are their charts. Where do you think mass use of masking was introduced? Do you think it was probably way at the top and then they put the masks on and the numbers came down? Just place on the graph where you think it is. And in every case, it's entirely random. And so it's a quiz. Now, I was a nerd in school, so the idea of failing a quiz makes me shudder even to this day.
Right.
But this quiz, it's designed for people to fail. Like, if you go in with this Fauci idea that the states that obey are going to do better, you're going to fail this whole quiz. And it's relentless. There are so many different little tests on it. So there's that. It's just forcing them. But then also, I had a little bit of a back and forth with a state legislator in Tennessee, Heidi something or other. I think she's running for governor. Heaven help them. But I said to her, because I don't know why she picked a fight with me out of the blue, but I said to her, all right, well, why do you think there's no obvious difference if you implement or don't implement these policies? Like, for example, when they took the masks off the planes, they were not afraid that we were all going to get sick. They were afraid that nothing would happen and that we would suddenly realize, well, wait a minute, taking the masks off on the airplanes doesn't do anything. Maybe ignoring all the rest of it doesn't do anything. Anyway, so I asked her, why do you think there are no obvious differences between these places when you adjust for age or adjust for obesity or whatever? And she came back with, well, the public health officials have already explained this. I said, oh, have they? Then can you at least repeat what their answer is? Because I'd love to hear it. So on diaryofcovid.com, I have a little video, 2-minute video, chronicling the few years. And I said to my video guy, there are 2 major TV clips I gotta have in that video. And it's of Fauci and Andy Slavitt, who was a COVID advisor, for once in their lives being asked a tough question. Because if you're going to tell me, oh, the public health people, they've figured this all out. Oh, yeah? Well, how about on the 1 in a million times they actually get asked a tough question, what did they think was going on? So Andy Slavitt is on, of all places, MSNBC, and he gets asked by the anchor, can you explain why the numbers between California and Florida aren't more obviously disparate? They seem to be quite similar.
Yeah.
And I thought, oh my gosh, somebody asked the question, capital T, capital Q. Oh my gosh, I have to see what he says. So his answer was, well, there are a lot of things that we think we understand about this virus, but it keeps on surprising us. So in other words, literally no answer. He has literally nothing. So then they asked Dr. Fauci, look, Texas seems to be doing basically okay. I mean, like, there should be corpses all over the street,
right,
according to this theory, and yet they seem to be doing okay with packed stadiums and everything. Like, what do you think's going on? And his answer was, maybe they're doing things outdoors. I'm not kidding you. They've moved the whole state outdoors. Even the Today Show made fun of him at one point because he had been on The View, and I guess Joy Behar, whatever her name is, said to him, you know, I'm seeing all these packed stadiums for college football, and I'm thinking that COVID's going to have a feast. What do you think? And he says, yeah, that's my fear too. And the Today Show even says, and I put this in my video too, the Today Show says, but it never happened. Deaths, cases, hospitalizations all plummeted. So that would be my question, would be if you're thinking, well, we got to just follow these people. None of them have any explanation for what is going on. And these very people, not a year earlier, would have followed the traditional pandemic preparation guidelines, which were don't lock the society down.
Right.
So what, am I supposed to obey them then or obey them now? The whole thing is nuts.
Did anything work at all that they recommended? Was there anything at all that worked?
I don't if it did, I just don't see evidence that it did. And the thing is, at the beginning I thought that maybe something had to help. Or maybe stay home when you're sick. If you just said everybody stay home when you're sick, that would have done probably more good than everything else they did put together.
There were a lot of people who were very much against mandates, lockdowns and mandates, but they were for masking. They were like, well, but masks, this obviously would work. Yeah. But again, the science on that is it seems to, I understand the logic of a person believing, well, of course this would work, right?
Me too.
But that's if you don't know the size of a virus, right? And how it just slips out. And it's like, it doesn't actually help unless you're wearing an N95. And then you'd have to wear it all the time. Like even when
you'll notice that a good chunk of the way through this book, I don't really say anything about masks because at the time I was withholding judgment until I saw.
Yeah, right.
The whole thing is driven for me by, did it have any results? I mean, it's also driven by, you have the right to live your life. But I'm willing to argue with them on their grounds of let's look at the numbers. And so I actually thought temporarily, because what do I know about whether masks work? No more than Fauci, apparently, but no less than Fauci. And I thought, I don't know, maybe this will be a path to normality again. But then, again, if that were the case, then the world would look very different than it does. I mean, they had these mandates all over the place, and you can't tell. You look at neighboring counties, that they're demographically identical, so you can't pretend that, well, there's a different demographic, and that's why the mask. These are the same people.
Right.
You don't see any obvious difference. But then also the final nail in the coffin of that whole thing was that Cochrane review, where they had done, they gathered together all the work that's been done and basically came to the conclusion that it's irrational to mask, even with those suffocation masks. I call them suffocation masks, or because I've had a doctor tell me if you're wearing an N95 for more than half an hour and you can do so comfortably, you're wearing it wrong. So I was told. But I've seen through, like, even the Cochrane review said that even when you wear or I sometimes call them duck masks because you look like a duck walking around wearing it. They don't seem to do any. They tried that in Germany. It didn't seem to make any difference.
Yeah.
And the thing is that I'm I want to have compassion for my fellow man. And I feel like a lot of people who bought into this weren't sinister. Their brains were broken by the experience. And so I don't want to
Right.
be cruel to them. And yet in 2024, somebody's walking by me in a duck mask. I just want to quack. And I'm trying. My wife's trying to keep me well behaved, and I'm under my breath. I'm going quack quack. And she said, "Will you stop starting things with people?"
Yeah, quack quack in a lot more ways than just looking like a duck. Also,
Yeah,
just
exactly. More ways than just looking like a duck. Exactly right.
Yeah. It is insane. I still see people driving around by themselves with a mask on, and I'm like, really, we're still at that point. I mean, I knew there was, in my mind, logically, there was no way masking was going to work, and I would argue this with people who were on my side when it came to everything else with the pandemic, but they really believed masking would work. And I would say there's just no way. It's no different than lockdowns. It's the same. It's the same idea, like thinking that you can run from a virus, that you can evade the virus if you just stay locked into your house. Eventually, you're going to open the door, and eventually you're going to go outside and the virus is still going to be there. Same thing with masks. Eventually, you're going to take it off. Like you can't live in it and shower with it on and sleep with it on 24/7. I mean, you have to take it off, even at minimum, just to change it. And when you do, the virus will be there waiting for you. There's no way to escape it. I mean, I see some of the benefit. I certainly do see the benefit of not wanting to catch a virus first, right? Not wanting to be the first one that ends up in the hospital where they experiment on you with like
Yeah.
remdesivir or whatever it is that they're experimenting you on with you on. Ventilators, right? Which we later found out were not a good thing, that was actually worse for people than it was helpful for people. So I can kind of understand that.
Yeah, no, I hear that, but on that mask front, though, I remember there was a study that came out from North Carolina where they had looked at the school system in North Carolina and said masks work, and our evidence, and the New York Times reported this, it was all over the papers. With our evidence that masks work is that the case numbers are very low in the North Carolina public schools, but then down in as usual in paragraph 29, they say, well, since all the schools are wearing masks, there were no unmasked schools to serve as a control group, so we had nothing to
Right. So
compare
we
to.
don't know.
So then there's no study. If there's no
Yeah.
control group, there's no study. It's
Right.
just unbelievable. And then the way that even the CDC would release these things about masks. And so they had one study that involved different portions of Kansas, and one had the mask mandate and one didn't, and they would compare them in a chart, and they would say, look at how much better the place with the mask mandate did than the other. And then they just cut it off right here. That's where they're going to end the study.
Right.
If you keep going, the exact opposite happens for vastly longer. But we never find out about that. We get no follow-up. We get no mea culpa, nothing. So if you were really just after the truth, you would come out and say, we need to clarify that study because shortly after we concluded it, exactly the opposite occurred. Not one word. Not one word from this. So it can't be a matter of they're really just looking out for what's best for us. Then they would disclose when they're wrong, and we never,
Right.
ever hear that.
Right. That's the most challenging thing about this is our government, in particular, I think the US government, which is like really bought off by a lot of these big industries. And so there's
Yeah.
there's heavy lobbying, but there were those Scandinavian countries that I looked towards, not Denmark, which is my family heritage. Sadly, I couldn't, Denmark kind of went nuts, but Sweden, Finland, they handled it very differently. Finland, for example, on their they didn't do lockdown. No one got on Finland's case. They didn't do lockdowns either. They didn't do any mandates, but they're an island. So they said, if you come to our island, you have to quarantine for a period of time before we'll let you off into the island, before we let you loose. But they put on their website, even I was following their data the whole pandemic, and they would put on the website, look, we don't know. But and when we find out, we'll let you know. This is what we think. We think it's safe. The vaccine we think is safe for this group of people. When we get more data, we will inform you. No one will be forced to take this. They even said, look, like some people we are requiring to take it, like hospital care workers who are working directly with patients. But they said, even the government said, but if you don't want to take it, that's okay. We'll just transfer you to a different department. You're not going to lose your job. Like they just handled it in such an adult way. And then, sure enough, eventually they said, okay, we're no longer giving Moderna to any of these young people.
Right.
We've now got enough data to say this is stopping. We have enough data now to say we're not even vaccinating anybody under the age of a certain age with any of them. Like it's just unnecessary. But our government just cannot be trusted. How do we fix that, do you think now? Like, going forward, how do we prevent this from ever happening to us again?
Oh boy, well, I mean that is the $1 million question. One thing that is encouraging is that they, and by they I mean the entire collection of bad guys in all parts of society, they wanted these vaccine passport systems to be permanent. Like we
Yeah.
know they wanted that, and they implemented them in numerous cities, not just Los Angeles and New York, but in a whole bunch of other places for some periods, some longer, some shorter. And even though people like you and me, we were not the majority, we were a minority that refused to go along with it. Okay, then I just won't eat at your restaurant. And then suddenly, the vendors themselves are begging for this to be lifted. We just won't. We just won't patronize these businesses. And you can't just. In New York, they had shut down all international travel because practically, and then when they resumed it, you had to have the shot. So international traffic into New York, which depends on that. I mean, their entertainment sector, Broadway, the Phantom of the Opera closed after 35 years because it didn't have that feeder traffic to keep it going. Without that, and then a big chunk of the domestic traffic refusing to go along, they couldn't carry this thing on. And in fact, I went to the Harvard Club of New York shortly thereafter, after the dust cleared, and I walked in and I asked, "Do you have a vaccine requirement to get in here?" And they were almost indignant with me. They said that was the city's policy, not ours. Like they wanted to say we had nothing to do with this. So the fact that we as a minority could still, I mean, we have to realize that was a victory. And we had very, very few high-profile people in our corner, almost nobody. We were a ragtag, disorganized group of dissenters, and we won. So that's why I would say, first of all, let's not lose hope that it's all hopeless. But I would say that one of the problems we face is that now thankfully the television networks are very old technology going down the tubes, but they are very heavily funded by the military-industrial complex and big pharma.
Right.
And it has been said sometimes that those TV commercials for those unpronounceable drugs are partly to get people to take the drugs, but they're partly meant to bribe the anchors into shutting the hell up.
Yeah.
Because you don't want us to pull the plug on you. So I do look at it as we, even as a minority, exert a lot of power. Secondly, more people than ever see through this. I mean, now you're getting a huge number of people, comparatively speaking, who are worried about vaccines in general, who had never even looked into the question before. So that's what public health has accomplished. Now they've got more skeptics than ever, and that has to be a good thing. But also, one other thing I want to point out when you're talking about how Finland handled things and vaccine passport systems and mandates and stuff like that, there were a couple of officials in Canada, and I chronicle this in my book, and I suspect there were Americans too, but who had the good sense to keep their mouths shut. There were a couple of officials in Canada who let it out that, okay, let's just be honest. The purpose of the vaccine mandates is not, quote, to keep people safe. It's not that we actually think you're going to drop dead in a restaurant if an unvaccinated person walks in. That's not, and we know that the vaccinated can spread it and all that. What we're trying to do is modify behavior. We're basically trying to reward people who get the shot and punish people who don't. That's what this was all about. Because if you look at the numbers, again, I'm a numbers guy. I was actually the co-captain of my high school math team. This is the one time in my life where that has been a net plus for me. It's not how you get the ladies, I'll tell you that. But all the same, if you look at Los Angeles County versus Orange County, they're right next to each other.
Yeah.
And Los Angeles County had the vax mandate, Orange County didn't, and you put the charts one on top of the other, and they're exactly the same.
Right.
So it never had anything to do with it. It really, it was a humiliation tactic, and we overcame it. And yes, I mean, people lost their jobs. I don't want to minimize what was done to people. But in the last, and there are still places that are demanding it. But in the last resort, ultimately, we did win on that. And we can't, sometimes we feel like it's like a boot on the neck 24 hours a day. So I'm always very careful to remind my readers when we do win something that we should be grateful that we won something and take that strength and momentum and push forward.
Hey guys, be sure to like, share, and subscribe if you like this segment. Now, you might be wondering, this seems like it's part of a bigger show. You're right, it is. The full show is at KimIversonShow.com. So what you're watching is just a clip. And if you want to get the full experience, then you got to go to KimIversonShow.com. The show airs Monday through Friday, 12 p.m. Pacific, 3 p.m. Eastern at KimIversonShow.com. That is where you can watch the full show. Here, you just get clips. So click on the link down below, go to the full show, enjoy. Otherwise, I'll see you next time right here. And be sure, once again, like, share, and subscribe. Thanks for watching.